Welcome back to TMI with Terrell and Martha. We love getting together with you, and you're watching us on YouTube, so we want you to like and subscribe. Also, put some comments in. We'd love to hear what you think about this program and ideas for future programs. And today, I'm very excited about the guest that we have. So, Terrell, tell us about.
Yes, welcome, Dr. Tennant Slack. I'd like to introduce him to everybody who is listening to or watching this show on our YouTube channel. Again, send this out to your friends. Anyway, Dr. Slack and I have known each other for quite some time. We run into each other at all kinds of events we do here in Gainesville. The spa participates in a lot of wellness events, and Dr. Slack has been a big participator in the wellness events that support local Hall County residents. And so I'm going to throw it over to you. This is Dr. Tennant Slack of Innovations MD, which is an amazing place here in our town, Gainesville, Georgia. But I'm going to throw it over to you, and we can talk a little bit about what you do and pain management strategies, et cetera.
Tell us who you are first, and how you got where you are right now.
Sure. I was born and raised here in Gainesville, and I went to Georgia Tech, majored in physics there. And then went to med school at Emory, and then did a residency in anesthesia at Emory, and then practiced anesthesia in Atlanta for about 15 years. Then I went back and did a fellowship at the Medical College of Georgia in pain medicine.
Yeah.
And really what got me to bring in this alternative component, which is what Innovation MD offers, is I immediately found that I needed more tools in the toolbox than what insurance covered.
Wonderful.
Unfortunately, insurance doesn't cover what I consider to be superior treatment.
You know, Martha and I have had several conversations on that.
I'm sure you have.
We have, and you know, we'll probably have more, don't you think, regarding these type issues?
Absolutely. And I think what's so interesting about you is you had a very traditional, you know, kind of cookie cutter education. I don't mean that in a negative way at all. That you went to Georgia Tech.
It's very expensive.
Physics isn't very cookie
expensive
cutter.
too. Yeah.
Emory, you know, very traditional medical, very difficult to work with. Okay, Emory, you know, my husband's a primary care physician, and if he has to deal with Emory on anything, he gets very frustrated because there's a lot of layers you have to go through. A lot of layers.
Wow.
But went to Emory Medical School, then got this additional fellowship. So what was the kind of thing you were seeing that said, hey, I know you said you need more tools in your toolbox, but what was going on at the time that made you think, you know, I need to pursue more education in this?
At least two major things. Number one, I came into this right as the prescription opioid crisis was beginning to peak.
Wow.
And I was asked by Jack Chapman to work with the Medical College of Georgia, not Medical College of Georgia, sorry.
The Medical Society.
Medical Association of Georgia.
Yes.
Their foundation on the opioid crisis problem. So that was one thing. I really needed other tools such that I could spare the opioid therapy. And then number two, and probably even more so, is I got, you know, for better or for worse, I tend to kind of internalize my experiences with patients. And it was very draining for me to get to the end of the road with a patient and have to say, you know, we've done everything we can do. I have nothing else to offer you. And seeing the look of suffering and disappointment in their face, I just got tired of it.
You know, anesthesia is one of those, I think, really interesting specialties because I've always loved seeing my anesthesiologist because they're going to take my pain away. You know what I mean? It's like you're having surgery. You don't think of anesthesia as after the surgery. You know what I mean? And so I think this is really important because pain is like the worst thing. And I have seen so many people's lives destroyed because of pain and because they got to the end of that road.
Right.
And they were told there was nothing else that could be done. And then they would go into things that weren't very healthy for them.
They would find their own medication.
To find that pain. And then, of course, we know what comes from that is that dependency. A lot of times your life gets destroyed. Your finances get destroyed. And I know everybody doesn't get to that point, okay? But I'm sure you saw enough of that it made you think you needed to look at things differently. So tell us about some of those different kinds of therapies.
Well, before I do that, let me read you a definition of pain.
Yeah.
Okay,
you have a
great.
What
better-
is pain and why
better
is it so
understanding,
complex,
yeah, a
right?
better understanding of the phenomenon in general. So
Right.
this is a definition from the International Association for the Study of Pain, one of the international pain guru groups.
Right.
And this is a 2020 definition. And their definition is pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual, actual or potential, sorry,
That's
tissue
okay.
damage. So that has a lot of layers to it.
Right.
That definition. But I think I can summarize it by saying that pain, by definition, is a complex mind-body phenomenon.
Yeah.
And as such, it can permeate all aspects of your life. And even without the pharmaceutical, the opioid complication part,
Right.
you would
That's a
subtract that.
separate thing. Yeah.
It can completely degrade. It's an existential problem.
Yes.
Because there are really very few phenomena out there in medicine that are with you like pain. There's diabetes, hypertension, numerous other diseases, but it is a painful disease
Right.
that is with you every day,
Yes.
every hour. And it's degrading mentally, it's degrading physically. It's associated with a mortality rate, higher mortality rate.
I was going to say it takes a lot of lives.
And it can then ruin the social aspects of your life, which are
Right.
extremely important
True.
in relationships. So it's when I see patients, unfortunately, like many people, people want a fix.
Yes.
And
And
quickly.
immediate.
yeah, there's immediate
Gotcha.
and fix. And I'm in a position in which I have to tell them that we're really, bodily degeneration, particularly spine and peripheral joint, is really a long-term management problem. And it's only going to be a question of how easy it is going to
Right.
be to manage in your particular case. And I often compare pain, especially spine pain, to the Middle East problem. I mean, I say that, it's kind of humorous, but it's really pretty accurate because the spine in particular is full of hot spots that can move around on a day-to-day basis with no warning whatsoever.
Wow.
And there is no one cure. There's no one approach. You have to monitor it and,
Right.
and do your best.
And you have to be willing to give and take. My brother died early, and he was basically a victim of the opioid crisis. So this is near and dear to my heart, the situation relative to pain, right? And he was already an addict. So I'm not saying, you know what I mean?
No.
But he had a workplace incident where he got hurt, and they put him without question, without asking about his history of addictions, they put him right onto opioids. And, what it did over time was exacerbated everything else. And even when he got off of it, his heart was already so damaged at the end of the day from all the other drug use and everything else that he died very early of a heart attack because of all that.
Those particular scenarios where you have a patient who has structurally proven source of chronic pain, and then you have to help the patient manage that. And if you completely subtract opioids from that equation, it makes it considerably harder.
Right.
So, I would say someone who has an addiction history, there are certain opioids we can use more safely than others in treating those patients.
Right.
But I would not say that opioids should be completely off the table. It just depends on the situation.
Well, even in my line of work, I think probably one of the most famous cases was Rush Limbaugh. Okay, Rush Limbaugh had back surgery
Yeah.
that, as you know, I've heard my husband talk about back surgery enough that it's like a last resort because generally you got about a 50-50 chance of feeling better on the other side. And in this case, he had pain that continued even after the surgery.
Right.
So after the time that doctors would give him prescriptions, yet he had lots of resources and that kind of thing. And so he continued to get the prescriptions. And then ultimately it was discovered. And in lieu of having,
Other
police,
types of treatment.
Yeah.
Oh, okay.
Well, in lieu of having charges brought
Right.
because he had opioids in his possession that were not prescribed for him.
Oh, yeah.
He went to rehab.
Right.
And I remember on that particular, I was supposed to interview his brother on that Monday when he went into rehab that weekend. And I remember talking to David Limbaugh over the weekend saying, I'm going to have to ask you about this. I can't have you on and not ask you about it.
It's
And
out there.
It's out there. And so he did. And he was great about it. And he appreciated that and it did change. And Rush had to go through complete rehab. And as far as I know, for the rest of his life, he didn't have any more problems, not necessarily with the pain. I'm sure he had to go through other kinds of pain management. But it shows how even if you're well educated, even if you have opportunities, even if you have resources,
education,
you
doctors
can find
have
yourself.
Like doctors are some of the highest risk people too.
You can
And
find yourself
especially
in that kind of
anesthesia
situation.
for that
Yeah.
matter.
Yes.
Yeah.
Because the
Absolutely.
access to potent drugs is so
Yes.
high. Well, I would address that by saying there is what I call the opioid use-misuse spectrum.
Right.
The vast majority of people exposed to opioids will be able to stop and start the opioid without a problem.
Right.
And then as you move along the spectrum, essentially it's a question of control. And the less they are able to control their consumption, the farther they move towards the addiction side.
Right.
Rush Limbaugh was probably not an addict, because an addict is a particular subset on this spectrum.
Right.
And it is a one-way street.
Right.
You are exposed and
you're
that's
done.
it.
Right.
It's
Yeah.
a disease for the rest of your life.
Right.
But you can fall along that spectrum so that you're not quite addicted, but you have a control problem. And that sounds like what he had.
Absolutely. So what are some of the treatments? And especially you covered the fact that it was not covered by insurance. And, that's a lot of people just shut the door when they hear it's not covered by insurance, because they think of their insurance as a healthcare finance program instead of a wellness program. And we've talked a lot about that.
Yeah.
So what are some of the treatments that you do outside of what might be traditional medicine?
Before I answer that, let me frame this. Again, you hear me say spectrum a lot. A lot of things in life are a spectrum. So the management spectrum of a chronic pain problem is from the very conservative side to the least conservative side. On the least conservative side, as you already know, is surgery. And on the most conservative side involves like biofeedback or no actually physical interventions on the patient. And then physical therapy, chiropractic, an interventional pain specialist that does the targeted injections in the spine. And so what I found was there was a huge gap after the particularly for spine, after the injections, it was surgery. That's it.
There's no
nothing,
intervening.
There's no other steps.
Procedures in between.
Correct. Or modality.
Under insurance.
Under insurance. So that gave rise to my wanting to try and at least have something in that gap
to fill the gap.
To offer patients.
I think that's a
these
godsend.
methods are, like much of wellness medicine, are based essentially in augmenting your healing and augmenting and focusing your healing apparatus in a given area.
Right.
And after years, probably more than 10 years of being able to compare these methods side by side, I can say unequivocally that the alternative methods offer longer duration relief and more profound relief.
I think that's absolutely amazing.
It is.
Dr. Slack, because today in this world, there is nothing worse than being in chronic pain. Like it literally will take someone's life because it is just
highly destructive.
Yes.
Corrosive.
Like you said, in all aspects of life. And the fact that the insurance won't cover this, to me, is insane. And hopefully we will get some reform as we go along. Everything else is reforming, so why not, right? But at this juncture, I think it's important for anybody who's listening to us to understand, especially if you're in any kind of chronic pain. This is something that you can take and move with, whether you're here in Gainesville or whether you are out somewhere else, listening and learning what your alternative choices and as we're talking now, there are alternative choices, but hopefully they'll become more mainstream as people like you who are educated and practiced in the field of medicine start saying out loud on shows like this or any other opportunity that we have some work to do and there are some solutions and we as a whole need to start looking at them.
In my particular case, I have so it's very important that patients understand, to me, very important that patients understand what it is I'm offering them.
Right.
And particularly in the alternative realm, and this is actually another question, particularly in the alternative realm, you have to approach it with caution, because many people are out there saying many things, some of which are deceptive, some of which are outright untrue.
Right.
So when a patient comes to see me, and I'm not self-aggrandizing here. I mean, this is just the way I do it.
Right.
Patient comes to see me, I sit them down personally and educate them in detail about what it is I have to offer and what they can expect.
Okay.
So in my case, personally, I have severe degenerative disc disease in my lumbar spine.
So you're dealing with this yourself. So you have real practical relationship with this.
So there's that.
Yeah.
And then what I can say to patients is, in my case, I've managed my pain exclusively through these other methods, no steroids.
Right.
And they have been exceptionally helpful at controlling my symptoms. However, they have not arrested the
degenerative disease. Yep.
Degeneration.
Look at me helping you.
In my discs. And so I never tell somebody, this is going to cure you, or I don't guarantee them I'm going to, even though the field is called regenerative medicine, I don't guarantee them I'm going to regenerate anything.
Right.
The key point is it is a very effective way to manage pain and improve your functional status.
So let me ask you this question, because you came out of the traditional medicine world. Should you try these things first before you get to medications?
Well, as you know, cash is king. So the number one reason why people don't explore these methods is the cash problem.
Right.
If these things were covered by cash, I'd probably be working 24 hours a day.
Insurance. Yeah.
Insurance, I'd probably be working 24 hours a day. So,
but if you could do those things first, do you think it's better to start with that kind of stuff?
Well, again, this comes to invasive.
Probably depends upon
what
the situation
is. Really.
Depends on the situation, and I'm always in favor of starting more conservatively.
Right.
So that means physical therapy, chiropractor, and what I do involves needles, of course. So it's invasive.
Injections.
So I would in favor of less invasive first.
Right.
But if it comes to needing a needle-based intervention, I would say these are the methods I use.
Yes. That's interesting, because of course I'm like any 66-year-old woman. I mean, I'm in pretty good health for my age. I've had 2 knee replacements, though. Right now, I'm getting kind of every 3-month injection into my shoulder. I've got a little bit of arthritis in my shoulder. I have back pain. I think what's the old saying that half the people have back pain by 40, 2/3 by 50, and everybody by 60.
Oh, wow.
It's some level of back pain.
Yeah.
Because
between spine pain and peripheral joint pain, I would say the majority of people 65 and over are experiencing.
And for me, my grandmother and my mother on both sides, both of my grandmothers and my mother all had osteoarthritis. And so since my 40s, I've been, seeing, but I'm very much about my primary care doctor. You know what I mean? We've been talking about treatments, and we've been dealing with things, and I've used a lot of ice. I've used chiropractic. I've used different things because I do have arthritis.
Right.
But what I find is the best thing for me is just to keep moving, as much as possible, to keep moving and be as strong as I can be. Not to say I'm opposed to any kind of intervention, and I do it, as it's necessary. But I think the first thing we ought to do is try to move through it and be strong as much as possible. And I don't mean you don't have pain. I'm just saying.
I understand. Well, personal responsibility is a key component of this. I had a patient that went to a, quote, fibromyalgia clinic down in Mayo, but it had a dramatic impact because it changed her mindset. And when she came back,
she looked at the situation.
Absolutely.
Yeah.
When she came back, it was much easier to treat her and work with her.
Right.
In your case, you're a classic example of someone who should consider these other injection materials. Because the reality of steroids is they work in the opposite fashion to platelet-rich plasma and other types of regenerative materials. And because inflammation is intrinsically tied to the healing apparatus.
Yes. Yes.
So when inflammation is suppressed by steroids, which they are very effective at doing that, it suppresses the entire healing apparatus. So from that perspective, steroids do not make good management tools.
Not long term.
Because if you
It's
keep getting these
symptomatic.
shoulder injections, you are going to need a shoulder replacement probably.
Mm-hmm.
Not that using these other materials would reverse that, but at least it would spare you from getting steroids over and over again.
Well, it's funny with my knees. I did the, what was the chicken thing?
Yeah.
What was that? I did
Rooster
that.
comb,
Rooster
the
comb.
gel.
I did the gel.
Mhm.
I didn't
chicken
do,
thing.
because I learned really early that the steroid shots weren't going to help me with my knees. And I
Yeah.
was bone on bone. So eventually I was going to have to get
Do
my knee
something.
replaced. But
Right.
I wanted to put it off as long as I could because they last about 30 years. I got them when I was around 60. So, I hope I won't have to get them replaced again,
Yeah,
but I
it's-
figured that was a safe bet.
Yeah.
I didn't want to get them at 45.
No,
I
I
could have gotten
understand.
them at 45,
Yeah.
but I didn't want to get them at 45.
But this goes back to something we've talked about on this show often, is that the body is a self-healer,
Mhm.
right?
Right.
And so what you're talking about, and I love hearing when educated medical doctors, medical professionals that come through our schooling can literally sit here and appreciate the actual, I call it divine design, but the ability of the body to heal itself. And what you're looking at is interventions that don't hamper the innate body's ability to heal, but you actually are enhancing by trying to relieve the pain in a way that's not going to shut down the body's natural healing apparatus. Is that correct?
That is correct. And I would say what I call the matrix effect is really in place now with phones and the internet. But in a larger sense, the pharmaceutical age has put us in a matrix world because we just assume that drugs are going to be the answer.
The solution.
But we forget that for millennia, we didn't have that. And the human race survived and healed.
yes.
And so really, there's nothing, intellectually stunning about this approach.
Well, and
just-
it's impatience. We want to feel better. We
That's-
want to
Yes,
feel better
it's the
right
quick
now.
fix thing.
And I think that also we talked about this before we went on the air that people in your line of work have been maligned to some degree because there are a lot of pain clinics out there that you see, and I know that's not what you do, but
No,
that's
I
what a
don't-
lot of them are called, that do what you do or say they do what you do. And they really are just pill factories,
Mhm.
as
Right.
opposed to actual pain management, which is I think any logical person understands that there are times when you cannot completely alleviate the pain as
That's
you
right.
get older.
That is
Right.
Any
absolutely true.
logical person will
we'll
understand
know
that.
It's a part
But
of the
there was a promise that was made by a lot of these folks that, if you do this, this is the magic bullet. You
Yeah.
know?
Well, and therein lies part of what I call the expertise crisis.
Yeah, which
Yes.
is one of you were going to get to that. Yeah.
Because with the way technology is now between phones and internet, it has become more about the impression the person makes rather than the substance behind that person. And so you're already talking about a complex problem, and then you
Mhm.
throw that in there with the promise of fix, and we're going to make your knee new again, and all that sort of thing is a very confusing for the public.
And
Yeah.
I've even seen these, so you get, I don't care where you are. It's like Alexa overhears me talking about something and then I start seeing ads,
Yes.
so it's out there. But there are very good physicians, which I will not name, that have good records that are
Mhm.
now hawking this stuff online that basically says, if you buy my stuff, I don't need to see you. I don't need to, but if you buy this, you're going to be better. And I think it's really important. I don't care if it's pain management
Right.
or any kind of management of an issue, which there's a lot of functional management. You need to have a relationship with a person that lays eyes on you.
It sounds like you're
Yes.
talking about this Dr. Drew urgent care kit.
Yes, I am. You're
Exactly.
very smart.
No. I mean, I feel the same way about that.
But Dr. McCullough's involved with it too, and Peter McCullough. And Peter McCullough, if you look at his credentials,
He should know better.
He should know better.
Yeah. Yeah.
well, money.
Money.
Yeah.
Money's the king. Money is king
And
of
so
a lot of
money
the
wins
control.
out over integrity.
Yeah.
And
Unfortunately.
in my practice, it's I didn't go into it to make money.
Yeah.
I went into it because this is how I want to treat people in practice.
Right. This gives you
So,
the freedom
Yes.
to operate in a manner.
Very liberating.
You don't have to deal with standard of care. You don't have to deal with.
I mean,
it's some. Yeah,
mainly you don't have to deal with insurance.
Insurance companies. Yeah. But
it's funny because my husband Lynn is now the doctor at the Hall County Correctional Facility, and that one of the benefits of that is it's a population that still respects doctors.
Mm-hmm.
He doesn't. It's a he gets paid once a month,
Right.
and there's no insurance, no Medicare, no Medicaid.
He's in heaven.
He just gets to treat people that actually need his services, and it makes him feel like he's accomplished something.
Yes.
When he was a day-to-day internal medicine doctor, which he, I know a lot of you out there were his patients, and he loved you very much. But as a day-to-day internal medicine doctor, you don't fix anything. You know what I mean? Because people actually listen
like a balance
to you.
and harmony.
If people actually listen to you, they wouldn't come back. Because he said if you would eat right, stop drinking, and stop smoking, I would have nothing to do.
Yeah.
Well, and part of my little lecture that I give to people is
I love it. I love lectures. You know that.
Yeah. Well, essentially, when a patient comes to see me, that's essentially what they get.
Maybe you should.
It's an interactive lecture, but part of that lecture includes emphasis on lifestyle, the elements of lifestyle. And if that came as a pill, as you say, medical business would go away. So
exactly.
What you can do with lifestyle is the single most powerful tool you have. And so when I tell patients, my goal for you is to open up a window for you to put your lifestyle to work for yourself.
The hardest.
They have to feel good to do some of the things.
Correct.
It's kind of a wheel that if you don't
the chicken
feel
or the egg, right?
Yes, if you're not feeling good, if you're in pain, you're not going to exercise. You're not going to do those things.
Well, the hardest thing for me in my because I had a big health journey over the last 5 years, and the hardest thing has always been I don't like to sweat, so I don't like to work out, and you know what I mean? It's like I don't like to work out.
Because of the sweat.
No, it's not just because of that, but it's just.
It's
I don't
not
like
fun
to do
for
it.
her.
So what I've done is I've incorporated it into throughout my day.
Mm-hmm.
Do you know what I mean?
Yeah. She just stays functional.
Parking far away, climbing stairs where I can, doing exercises while I'm watching TV. I have a rowing machine in my office that I use. It's not a clothes hanger. It's a rowing machine. It's a rowing machine that I use, 3 times a day for about 10 minutes. Okay.
Have you gotten the under desk treadmill?
Not yet. No.
I have one I'll give you. It's very nice.
Do you use it?
I don't because it hurts my back.
And you don't
it hurts your back.
And you probably don't sit that much.
No, fortunately.
Yeah.
Fortunately for me, sitting is my biggest problem.
Right.
So I'm in
Up
my
and out.
job, I'm up and around and sitting.
That's the big thing now.
I went to go visit him, and he was walking through his clinic with his own IV going on. He was getting his Myers cocktail. And it was great because I was like, this is the kind of place that would just automatically make someone feel comfortable. And you having your own back problems, and your own experience with it will kind of build some credibility and credo for someone that's going in pain, scared, save the money or has the money
We're all
to try
going
to
through it.
Throw the money into something more natural. Maybe they've tried everything else.
That is often the case.
Yeah.
And it's not unusual because I honestly am just trying to save people money and get them the cheap, at least expensive sort of approach possible. It's not unusual for me to see somebody innovation if they have not been adequately worked up to say, come see me or somebody under insurance, get some things worked up. Let's get some more information.
Right.
And that way I'll have a better idea of how you will respond to these cash, based procedures.
Right. Already kind of trim it down through insurance and then leave the things that need to be cash based to you.
Well, and hopefully insurance is going to change.
It will.
I mean,
we're going to make it.
I don't know about that.
I mean,
I'm pretty cynical about that.
Well, it's okay to be
rightly
cynical,
so. Yeah.
I think that we've already seen some things they're going to do with pre-certification, which is going to save a lot of time and money and references and people in offices. But in the change, I think about pharmaceutical ads, which is coming, is going to be important because how many people call a doctor's office? I know my father-in-law is like on speed dial to his doctor's office and he sees an ad and he's calling them up.
I mean,
Can
what
I
a
have
pain
this?
in
Can
the
I
butt.
have this? That's not the way it should be done.
Not at all.
No, we're one of the only countries other than somewhere New Zealand that even is allowed to do.
Well, and there's a problem with advertising something that you can't get without a prescription. So you're advertising the person that can't get it without going to their doctor to get it.
You're manipulating.
It's just, how I love the triangles.
Yes.
It's a triangle that doesn't work.
It's kind of a different version of Dr. Google.
Yes.
I love Dr. Google.
Well, Stratton, real quick, I wanted to also have you mention just to us and to the viewers, what are some of the main differences and approaches you take? What are the difference between the alternative, pain intervention and the more traditional route pain intervention? Like what do you actually do that's alternative, and how does that relate?
In my toolbox, the fundamental difference is the basic underlying mechanism of action, which focuses on utilizing, taking advantage of the body's intrinsic healing capacity versus covering it with a steroid or pharmaceuticals or whatever.
Okay.
That's the fundamental branch
baseline
point.
Difference. Okay.
In my particular situation, I try and have a mind-body approach.
Right.
So the basic interventions are injection-based, device-based, or integrative medicine-based.
Okay.
And then I also, because of the mind component, actually have a microcurrent neurofeedback device.
I love those.
Which can be very helpful in calming the mind, because if the mind is working against you, your pain perceptions are going to be greater.
I love
How
that.
big of an impact is sleep? Because if you're in pain, you're probably not sleeping well. That
True.
compounds the problem. How big is that relationship?
It's massive. That is one of the 4 pillars of lifestyle: movement and exercise, nutrition, diet, mind, and sleep. And so there are a lot of people with pain problems where their sleep is disrupted. That's one of the first things I try and attack, because if you're not sleeping, nobody's
I know there's
happy.
a lot of people out there that are going, okay, this is starting to sound like.
Well, and if you're not sleeping, your body can't heal where you have pain.
Yeah.
Yes.
Plus, it's terrible. It's very bad for you not to sleep.
Agreed.
This is why Bill O'Reilly is advertising Relaxium and other people.
It's true.
Mm-hmm. I do think for sleep, though, because it is so important, I do think that's where I'm have a more open-minded approach to pharmaceutical interventions. Because even if it's melatonin, that essentially is a drug.
Mm-hmm.
Yes.
But I think the benefits of having sleep versus the downsides of taking a drug, the benefits of having sleep outweigh that.
Well, I think that should always be the thought process anyway.
It
when
should.
you look at any kind of intervention,
Yes.
right? Especially when you're dealing with pharmaceuticals, are the consequences of me taking this drug worse than the problem I'm having?
Mm-hmm.
And if everybody would just approach doctors, patients, everybody would approach the pharmaceutical drugs in that way, or even, loads of supplements, you've got to look at that too. I think we'll have a healthier world just in part.
Well, the risk-benefit ratio should always be in place no matter what we're talking about intervention-wise. So you're right about that. If patients, so I tell patients, particularly if it's an opioid, I say, look, this is a tool in the toolbox.
Right.
If you use it appropriately and it helps you, and that outweighs your side effects,
right?
Do that.
And do it just as directed.
Correct.
And that's where
I think that opioids have gotten, as a result of this prescription oversupply.
Mm-hmm.
Opioids have been vilified to a point that I think has gone too far the other direction.
Well, it's the whole throwing the baby out with the bathwater.
I have a theory. I wrote a book about 20 years ago called Indivisible: Uniting Values for a Divided America. And there's a chapter in the book called The American Pendulum. And I'm sure it would apply to other countries too. But the theory is that we take good ideas, we go too far with them.
Yeah.
And then we go back the other way too far.
Yeah.
And then you got to find the center,
Mm-hmm.
and that's kind of, you're right, because I have that attitude. I had surgery, and I was like, I don't want to take the opioids at all because I want to be able to start driving as soon as I can because I'm a busy person. And so you have this attitude, you don't want to take opioids because they have this lingering effect, that kind of thing. But there are times and places where
they-
opioids would be appropriate.
Yes,
Absolutely.
Yes.
very much so.
Yeah. I dare say that pendulum effect is why Donald Trump got elected.
Exactly.
You're right about that.
No, that's
Yeah.
very
You're
true.
right.
That's very true. It's swinging.
Well,
So-
I can really start a discussion. I always say that Barack Obama and Donald Trump are two sides of the same coin,
Mhm.
you know,
Yeah.
because they wanted change,
Mhm.
Yes.
you know, and it wasn't the change they thought they were going to get. And then it led to the other thing. So it kind of is two sides of the same
I always
coin.
believe that we'll get there. And
That's a
and
good
that's
point.
why
Eventually. We will.
Yes, I always believe we'll get there. But that also is what gives me the tiniest bit of hope about the change regarding insurance. Because there's going to come a time, because the more doctors I meet, the more friends that I know that are in this medical world are stepping further and further away from insurance. So, and the people that are paying the insurance companies their hard-earned money are becoming more and more frustrated.
Absolutely.
So we're going to get to a point where those two things will meet and insurance will have not the leverage that it has now. And I think because we're coming up with creative workarounds, you know, for insurance and alternative ideas for people to help them afford certain costs and everything.
Mhm.
So I think it may take some time,
Mhm.
but I think we're going to get there. Maybe we won't see it, but just for my curiosity, when you talk about injections,
Mhm.
right? When you do injections, can I just ask what are you injecting versus what gets?
Yeah.
Yeah. Could you just?
What goes through the end of the needle?
Yeah. We don't have
Yeah.
a whole lot of time, but I'd love to know what you use
Well,
or what is
so
used.
the main material by far
Mhm.
that insurance covers is steroids.
Right.
And I already
right.
mentioned to you the downside of steroids.
Right.
I use a combination of different injections, which would be a complete, episode in and of itself.
Yeah.
But
And maybe we'll do that.
there are materials that come from you, and then
Right.
materials that do not come from you.
Right.
The main material I use that come from you is derived from your platelets.
Wonderful.
Because your platelets,
Mhm.
there's a reason why they're released early in the injury process.
Right.
One is they promote coagulation.
Right.
Two, they help activate the healing apparatus. So they
Okay.
have growth factors and signaling chemicals in them that move the healing apparatus
All right.
forward.
Makes sense.
You can also obtain stem cell material from your fat or your bone marrow.
Wow. Okay.
I personally don't pursue those because they're very expensive treatments.
Right.
They're very invasive. I've had both done to me. I
Right.
don't want to do either one of them again.
Did it
and
work?
Well, no, I think
Did
it
it
was
help?
helpful.
Yeah.
Yes. But my
Yeah.
point is that I don't think it's any more helpful to have a super expensive one-time injection versus incremental injections with something far
Consistently.
less expensive
Right,
and
right.
less invasive.
Right.
And then in terms of things that don't come from you, and I'm kind of rushing because I guess we're
right.
about out of
We're
time.
kind of getting there.
We're good.
Mhm.
Yeah.
Yeah.
Okay. Material that does not come from you is derived from the placenta and umbilical cord of a healthy mother, healthy baby that's gone through a C-section.
Amazing.
So this arena is frequently mischaracterized as stem cells. That's
Right.
really not correct.
Okay.
Florida is now an exception, and that's a whole nother conversation. However, these materials are largely made available through an FDA exemption pathway, which
Wow.
allows them to be sold to an end user like me because of its growth factors and signaling chemicals.
Wow.
So if you combine that family
That's
with
exciting.
the
Mhm.
platelet family, you get two families of growth factors. And then third is ozone, which you probably
I love
familiar
ozone.
with.
Yes, I've been using it.
Yes.
Mhm.
So ozone, when used correctly, is an excellent adjunct to these treatments. So I often will include ozone as part of the injection. And then lastly, prolotherapy, where you take dextrose or some other irritant and you inject that into tendons and ligaments, which basically stimulates the healing apparatus.
I love that. Like this is
That
like
doesn't include
so exciting.
the near
Yes.
infrared and pulse electromagnetic devices
Devices that you
or
can
the
use.
integrated medicine part. So that's just the
Yeah.
injection part.
I mean, how exciting, because you're basically putting into hyperspeed your body's own innate ability to heal things. You are triggering the innate character of your body to go in and heal certain areas on its own. And oh my God, I love it.
Well, and I will say, I'm frequently asked, well, I'm older. Is this going to work? I'm like, yes, it's going to work, because when your healing apparatus goes to zero, you cease to exist.
Right. Yeah.
So I have a gentleman, probably about 80. He's a retired pathologist, terrible knee pathology. He is determined not to have a knee replacement. And these methods have given him enough relief, such that he continues to want to avoid knee replacement.
I love it.
I'm not saying he shouldn't have knee replacement.
Right.
This is his decision.
He's just
that's what it should be.
Right.
It should be your
It
decision.
should always be that.
Absolutely.
Yeah.
So if people want to find out more about you or maybe come to see you, how would they do that?
You can just go on the internet and put in Innovation MD, and it should come right up in a Google search.
Yeah.
Mr. Google's good for that.
Yes.
Mr. Google has some good points.
Yeah. And, I'd love to invite you to come back on the show, and we could kind of go over some other topics as it relates to all these things, because I think if there's one thing we share with each other as a human race and as a population, wherever you live, is that, pain is a part of someone's everyday life at some point or another.
It is.
And I think it's an important thing that we should discuss. And it's great to have someone that's as skilled as you are and has done a little of both, and is working with.
Well, and the whole mind-body relationship, because people handle pain differently. It's a very subjective thing.
Yeah.
It's not an objective thing.
That is probably the main reason for the complexity is the mind part. How the mind handles all of this pain data that comes into the brain.
Yeah.
Dr. Tennant Slack, thank you so much for being with us today.
I enjoyed it.
We appreciate it.
Yeah.
It's always great to be here and talk about these subjects. Of course, we want you to like and subscribe on YouTube and put some comments. Let us know what you think.
Yeah.
And we'd love to have suggestions of topics from you. But thanks so much for being with us today.
I hope you enjoyed the show. We go out of our way to try to make sure that we're bringing on the most educated guests that we can bring to give you some good information about your health and healing. Because as you all know, Martha and I care about you. We believe wholeheartedly that your wellness deserves a little overcare.